Welcome to our program. Today we are going to look at the Council on Linkage's Public Health Competencies, 8 domains. And joining us today is Janet Place, the Director of Workforce Development at the Arnold School of Public Health in Columbia, South Carolina. And Janet is also the co-chair of the Council on Linkage's Core Competencies Committee. Welcome to the program, Janet.
Thanks, David. Glad to be here.
Today we're going to talk about the Council on Linkage's competencies that are widely used by public health practitioners. And Janet, specifically, we're going to discuss the 8 competency domains. Now, just a reminder to our audience, these domains and all of the Council on Linkage's competencies may be found at the Public Health Foundation Train Learning Management System. That's www.train.org. Janet, what is important to know about core competencies in general?
Well, David, the core competencies are based on the 10 essential public health services, which of course are based on the 3 core functions of public health. And I'm sure most of our audience has seen that wheel of the 10 essential services, and right in the middle of it's the big circle that says research, because research is part of everything we do in public health. And, we know that public health is evidence-based.
Let's look at the first domain, the domain of analytical assessment. From a public health employee perspective, what's that domain about?
Well, assessment is a core function, so that one lines up pretty well. If you want your work to be evidence-based, you need to understand data, where to find it, how to determine if it's valid and reliable. And so that's what this domain is about. If you're doing community health impact assessments, again, that's what this domain is about. How do you gather that information in order to make an informed decision? In terms of the evidence-based public health framework, you need data to develop your issue statement when you begin your program planning or your policy development work.
Those are good points. I know a lot of the health departments are doing a lot of MAP assessments right now, and so all this is very timely. Can you tell us how maybe a health department employee may use the skills in this domain?
As I said, that if you're doing an issue statement or beginning to do program planning, you need to base it on sound scientific research. And so these are the skills that will allow you to determine what the best information is, both in terms of qualitative research, like focus groups, and quantitative research, such as surveys and other ways of gathering data. Also, of course, knowing how to use the scientific literature, finding things like, using PubMed, for example. How do you find the information?
Okay, very good. Let's look at the second domain. That's the policy development program planning. Again, from a public health employee perspective, what's that domain about?
Well, again, we can look at the evidence-based public health framework, in which you start with an issue statement, but then you need to quantify the issue and find the scientific data. You've done that in the first domain. Now you begin to develop your project or policy. So you want to develop an action plan, you want to develop a logic model, you need to understand the ramifications this policy or program may have. It's those steps in basically program planning which are critical to all public health employees.
Can you tell us how, again, a health department employee may use the skills in this particular domain?
Well, may use the skills to develop an action plan, to work with local partners and stakeholders to develop that action plan using a logic model, and perhaps most importantly, these are the skills that will help you develop the evaluation protocol for your program or policy.
Okay, very good. Janet, the next domain is the communication domain, and that one's kind of interesting because when we do self-assessments across the country, this is the one that public health employees really feel comfortable with and score themselves high. Let's talk a little bit about that domain.
Which is kind of interesting because across the country you also see people scoring themselves lower on the next domain, which is community dimensions of public health, or I guess that's 2 domains away. And you can't really have good community work if you are good at communication. So it's interesting. But communications, I mean, it's just the most important thing with working with clients, with partners, with stakeholders, everybody you come in contact with. Suppose you have a program or policy that you're trying to promote. The way you do that is going to determine whether people pay attention. Another aspect of this is health literacy. Are the materials you're developing for clients or for the community reading level appropriate? Are they culturally competent? These are all things that have to be kept in mind. I mean, you hear stories about people coming into a health department and, you know, being greeted or not greeted by somebody at the front desk, and someone who cannot communicate well, and you know, and these are the kind of things that are not good for public health. So being able to communicate clearly and politely, I mean, these are all important steps. So someone in a health department needs to understand how you communicate, especially with partners and your clients.
Those are all good points, and my next question was going to be, you know, what kind of skills do they need to possess, or what are the skills that they're gaining in this domain? And I think you've answered that through that.
Well, I can add to that you know, one of the key things is providing risk communication. And in risk communication, you need to learn that you develop 3 key points and you stick with them. Because you know what's necessary to put forward, and you just stay. And so those are the kinds of things that somebody in a health department, especially in case of an emergency, need to know.
The next domain, cultural competency. Now this is an interesting domain because when we do surveys, a lot of people want more information and more training on cultural competencies. What is this domain about?
Well, yes, you're right. Cultural competency as a training need has been around for a long, long time. And of course, it's difficult to teach cultural competency, but you can teach methods for making sure that you are being culturally sensitive. I mean, the term you hear more often is cultural humility. So in cultural competency, you want to make sure that you have interpreters on staff and accessible, that you have health education materials that are in the appropriate language. You need diversity of input when you're developing a program, especially if you're developing a program for a community from another culture with different cultural values. You need that community to be involved in order to get buy-in, but also to make sure that this program is going to work. There are also things that people need to understand about, you know, religious beliefs with regard to health services, and these are things that can get somebody in trouble if they don't understand. It can be very insulting to the client, which doesn't do much for making sure that the client follows directions or actually can improve. So that's just a key piece.
So some of the health department employees, some of those skill sets in that domain, can you kind of give us an example of what that would look like?
Well, I think the biggest thing is around inclusion. It includes both making sure that the workforce is diverse, as well as, you know, so that your clients do not feel like there's a separation. You need to make sure that they're interpreters. You don't want a family member of somebody coming in and doing the interpretation. That can be very culturally insensitive. And so, especially it's just thinking about inclusion, and inclusion in terms of program development, policy development. You can't just develop something and impose it on someone or a community with different cultural values. That's got to be taken into account all the way along.
Okay, that's an excellent point. Janet, the domain public health sciences, that's an interesting domain. It generates a lot of conversation. What can we talk about with this domain?
Well, yeah, this is one that's kind of interesting, and not all the skills relate directly to people who work in local health departments. A lot of it is about making sure that public health professionals understand the core foundations of public health, which is in the area of epidemiology, health policy, biostatistics, health behavior, and so these are things that people should have a basic understanding of. Now, within that domain are also the skills of understanding the 10 essential services and the core functions, and understanding the history of public health, which is not only fascinating, but also shows where mistakes have been made and what we can do better in the future. And so those things are in there. There's again the skills that are needed for determining if the scientific study is valid, again, like the data and assessment domain. But these are foundational, and it's something people should know, but the level in which they need to be grounded in it, may vary, and it certainly varies from tier to tier.
Yeah, exactly, and it's a skill set that really may focus on a smaller segment or group in that health department. And let's talk a little bit about some of those skills.
Well, again, and I know that when we were revising the competencies in 2010, I know I felt very strongly that domain should include the knowledge about the 10 essential services and the core functions, because it's quite amazing to find out how many people don't realize that there are such things, and they do the work. But and again, the history of public health, these are all things that people should be aware of. And so I think those are the basic things. I mean, not every, but it's very common for health departments to require their staff to take a course in Public Health 101. And that's what that course is meant to address, the public health science skills.
The next domain, and it's an important one these days in the environment that we're working in, financial planning and management. Describe that domain for us.
Okay, that's the domain that really scores highly on need, and across the country, and has done for years. And this is about managing people, managing money, and managing information. And these are all things that are critical. I once had a local health director tell me that he thought the most important skill that a health director needed when they came on board is an understanding of how not to get into trouble. Getting into trouble with personnel rules or other things that are there, and people need to understand them. Certainly the management of money. How do you do a budget? How do you write a grant? These are all skills within that domain, which is why that domain is really the longest of all of them. Because if you don't have these skills, you're going to be in trouble. Again, this depends, the level at which you need these skills depends on the tier. You certainly need to know, as a tier 1 individual, how to write a grant, for example, and how to analyze the budget, and how to follow a policy. As you move to tier 2, especially, this becomes important because that's the management level. So you need those skills for dealing with people, money, and information. And of course, as you go up to leadership, there's a different understanding of what's necessary. And the skills are also increased in level. But this is a very important domain and the one that people are constantly asking for.
And we do keep, just to re-emphasize with the tiers, because we do keep referring to them, that tier 1, tier 2, and tier 3, that really is designed to follow the career path of an employee. An employee coming into it is probably considered more of a tier 1 into the system.
Someone who's coming into public health can look across those domains and see what skills they need to be developing in the future or now, so they can move to the next tier.
Right, so as they progress in their career and move into kind of more middle management positions, those tier 2 competencies become more important. And then later on in the career, when leadership and those tier 3.
There's a model that was developed in the 50s out of the Harvard Business Review that shows the trajectory of a career. And at the beginning, or say tier 1, it's very important to be strong on the human skills. So here you have communication and community dimensions of practice. As you get into tier 2, it's more technical. How do you write a budget? How do you present it to a board? Those kinds of things. And as you get up to tier 3, you're really talking about conceptual skills and systems thinking skills. And so that very much applies in this case.
Absolutely. Those are all excellent points. I'm glad you brought that up. So back to this domain, some of the skills that a public health employee might be looking for.
How to do a cost-benefit analysis, how to, a big piece of this is, informatics. There was, at one time, there was discussion about adding a separate domain for technology and informatics, but it was thought, but like research, this is something that happens in all domains. But informatics is important, and having a basic understanding of it in order to then, get the right people to come work on your informatics system and whatnot. That needs to be understood, especially at tier 2 and tier 3. How to write a budget. I mean, again, that's something that we hear all the time, and one of the mistakes we in academia make is that people want finance, management and finance training, and we send out folks from our business schools, or we send out people who are used to working with corporations, and they're coming up with a much higher concept type of training. And when you talk to the people in the training, they say, but I just want to know how to write a budget. This is the idea that these are the most practical skills you need to be able to manage your health department.
Yeah, we could probably do a whole separate program on informatics. That's
exactly. And there's lots of training out there on informatics. It's the kind of thing that like so many disciplines have their own competency sets, which build upon the foundational competencies, the core competencies. Right. And so, if there's a public health professional gets more involved in informatics in their health department, well, then they're going to start looking at the informatics competency in order to build those skills further. But it's very important, especially with electronic health records and all those things coming down the pike.
Absolutely. Let's talk a little bit about the leadership and systems thinking domain. Let's kind of walk through that domain a little bit.
I mean, I think that, leadership comes at all levels. I always love the quote that leadership is a process, not a position. So, it's there. What the leadership domain is talking about is really systems thinking skills, understanding how public health is funded in the United States, from federal to state to local to fees, those things, and just the broader interrelationship between agencies and associations and other entities in the public health system, which also include, Department of Defense and Department of State, and all these things are interacting. In a leadership position, there's a strong emphasis on building teams within your organization, how to motivate people. So this is tier 2 of this is really sort of at the program level. You're doing leadership within a program. When you get to tier 3, you're talking about agency level or even community level change. So it's thinking big. And at this point, you might be developing policies for the organization, the agency, and as you move back down the tiers from tier 2 would be implementing those policies, and tier 1 would be following them. So it's the big picture stuff.
Absolutely.
But certainly, people in tier 1 need to understand, how public health is funded and what agencies do what, and all those things are important all along the way. The system skills.
Again, looking at some of those individual skills in that domain, could you kind of flesh that out for us a little bit?
Well, certainly those around team building and promoting lifelong learning. That's really, remember, essential service number 8 is assuring a competent workforce, and so that falls within the leadership skills is making sure you're creating a learning organization and providing opportunities for the staff to grow. That's part of performance improvement. These are key things that people need to understand. And as I said, it's if you're at tier 1, you're probably looking at that. You're looking at leadership skills from a more human standpoint, and that's leadership with a coalition or facilitating leadership in the community. But by tier 3, it's taking a leadership role and affecting the entire agency, and so and your community, and it could be national work as well. So it's something that you have. You don't, as you move your career, you don't necessarily develop leadership. You can take leadership training, but it's also it's part of motivation. What motivates you? What helps you improve the status of the population? Those skills all the way through the tiers. I think we could have said at the beginning, but that those who may not know, the competencies were recently modified. Not changed completely, but modified, that took into account the suggestions of practitioners. And the reason why we're doing this is that people often didn't understand what the domains were or what the skills meant. So they were modified to be more understandable. And so if you haven't looked at them in a while, you can go to that URL that David mentioned at the beginning and check them out again, because you may find that they are much easier to work with.
Absolutely, all good points. And I'll have that URL up on the screen again here at the end that people can refer to. This has been very, very good. This is, again, our part of our series of exploring these cultural and competency domains and individual competencies. And again, Janet, thank you very much for taking the time out today to talk to us. And I thank you for taking the time to be with us today, and we look forward to bringing you information in the future on the Council on Linkage Competencies.